Thank you. At the outset, I would like to thank the organizers for giving me this opportunity. And I'm very happy to see a good crowd, especially including a lot of young students, because the key to success for any tobacco fight is involving all the stakeholders. So in the next 15 minutes, I would like to take you through the tobacco control, the impact of tobacco epidemic, which is affecting India. Globally, tobacco has killed 100 million people in 20th century. This number is more than of all the people who died in World War I and World War II. And if the same smoking patterns continue, by end of 21st century, it's going to claim 1 billion lives. So that is the kind of figures we are talking about. In the 19th century, we were struggling with malnutrition, communicable diseases. And as our previous speakers have highlighted, the 20th century is the century of NCDs, that is non-communicable diseases, which will claim the biggest number of human lives in the humankind, which includes cancer, diabetes, cardiovascular diseases, and chronic respiratory diseases. The good thing about these diseases is they are modifiable, they are preventable. They are mostly related to lifestyle factors, what kind of life you lead. So if you start educating your public, most of these conditions, almost 70 to 80%, you can either prevent or decrease the burden. They have a lot of socio-political challenges. We need a multi-dimensional, multi-sectorial aspects to control these aspects. It's not only the doctors and nurses or medical students who can tackle this. We have a lot of stakeholders in the whole game of tobacco campaign. There's a potential to widen gap between rich and poor. These epidemics can play havoc with countries. They can, people in young and productive age groups, they can slow down, they can drag down the economy of developing countries. So if you look at this pattern of NCD deaths, non-communicable diseases between 90 and 2010, just within a short span of 20 years, NCDs has increased from 50% to almost 2/3 of the deaths. As you are controlling infections and malnutrition and changing lifestyles, we are happy that we are having nice fridges, nice televisions, good cars, and good life, and we are paying a price for leading these kind of lifestyles. If you look at the brief history of tobacco, I think the French should be thankful to Christopher Columbus, and Indians should be thankful to Portuguese people who have actually introduced tobacco. This is in the last 400 years. And if you see how it has just galloped into a global tobacco epidemic, just after the introduction of tobacco into these two regions. And I often wonder the kind of havoc this is playing, this often simple, innocuous looking plant. This is called, basically, tobacco is derived from the leaves of the Nicotiana tabacum plant. And the main component which drags the patients for addiction is nicotine. And these are the various types of tobacco products. We have different patterns. In the Western world, it's mostly cigarettes. And in developing countries like India, it is mostly smokeless tobacco, what you call pan masala, tambaku, that is playing a big havoc with low and middle income countries. If you look at the relationship between tobacco and non-communicable diseases, tobacco has been incriminated in almost all NCDs. Starting from the heart disease, it increases the risk of heart disease, cancer, diabetes, chronic respiratory diseases, and it plays an important role in causation of all the NCDs. And it can affect most of the organs and organ systems in the body. And these are the list of cancer-causing carcinogens which have been clearly identified, which are present in tobacco. Tobacco damages not only the whole person, but the whole planet. So we often think it is we laugh at the smoker, but he is not just destroying himself. He will destroy his surroundings, the second-hand home, which affects his family, the wastage produced from the tobacco use, which will damage the environment, ultimately leading to degradation of the planet. These are few facts and figures. Globally, tobacco kills nearly 6 million people each year. 22% of the global cancer deaths are due to tobacco. 90% of the deaths from chronic respiratory diseases we are facing in Delhi or because of cigarette smoking. 70% of all lung cancer deaths can be attributable to tobacco smoking, and 10% of cardiovascular deaths. So what it shows is it's a major preventable cause of premature death in the history of humankind, and it is the ideal case for public health intervention. with minimum investment and maximum benefit. Tobacco is the risk factor for 6 of the 8 leading causes of death globally. These are the causes ranked in the global mortality list, of which 6 have been attributable to tobacco. And these are the projections. If you just continue the same lifestyles and same types of smoking patterns and these tobacco patterns, these are the kind of mortality figures you are going to see in the next 15-20 years. These are projections for 2004 for high-income countries, middle-income countries, and low-income countries. The middle blues, there are the proportion of NCDs. You see how they are increasing every decade. And this is the global landscape of tobacco use. The dark parts are actually where there is a very high prevalence. Unfortunately, it is the Europe, North America, which have a very high incidence, which of course in the last 10-20 years are able to control the tobacco epidemic in these regions. India is somewhere in the middle. You can see it's around 20 to 25. That is the percentage of smokers. But this demography is slowly shifting. As the laws are tightening on tobacco companies in the Western world, they are switching their markets to developing worlds, especially Asia and Africa. You see the proportion of this tobacco industry reaching new developing countries. These are the share of world. In the 1970s, in developing countries, the tobacco usage and mortality was around 40%, and by 2000, it is touching 70%. So they have very brilliant marketing strategies. So to counter these epidemics, that's what I was telling, you need a multi-pronged attack. And currently, the top 10 consumers of tobacco, global ranking, we have a ranking system for tobacco use. China tops the list, followed by Russia, USA, Indonesia. India is in the 7th position right now. And these are very interesting figures. The global cigarette consumption has gone from number of cigarette sticks, 10 billion sticks in 1960, now it is touching 5,604 billion sticks in 2002. That virtually, if you do a calculation, tobacco companies are producing cigarettes at the rate of 5.5 trillion cigarettes a year. That means 1,000 cigarettes for every human being, including men, women, and children, 1,000 per year. Everybody must understand how the tobacco epidemic affects a country or a continent. We are not talking of 5 years, 10 years, or 20 years. You see, this is a 100-year plot here. Suppose a country starts taking up smoking, and in the next 20 years, it will start seeing the effects of tobacco. So what you are doing today, it will pay dividends after 10 or 20 years. So that is why a long-term perspective is extremely important when you fight tobacco menace. So this is a graph, typical graph. First, the male smokers in any country, followed by female smokers. They smoke for 20 years. Then the effects of tobacco will be obvious. The mortality will increase. So any measure you want to take, it will have an impact after 20 or 30 years in the long term, at a national level or a continent level. Coming to few facts and figures about Indian scenario, India is the second largest consumer and producer of tobacco. It accounts for 10% of the world tobacco area. It employs a large number of people, almost 1.2 to 1.3 people who are engaged in the tobacco industry, in the manufacturing, collection of tobacco leaves. There are 55 lakh BD workers. So that is why these tobacco companies take often the excuse of livelihoods. So they say, what will these people do? They will lose their employment. So these are the kind of angles that will come into play when you try to fight tobacco menace. And these are the realities of India, where a lot of children were also employed in a small sector, unorganized tobacco manufacturing units in rural India. And 275 million adults in India consume tobacco, highest incidence of smokeless tobacco usage in the world. These are the facts which have come out from the GATS India report, which is actually a global adult tobacco survey. So this will give you an exact number of people who abuse tobacco in India. The current tobacco use, any form, is 34%. And smoking is fortunately less in India compared to the West. The biggest problem is smokeless tobacco, which is called SLT. It's almost 26%, 1/4 of the population in India now use SLT. And the surprising thing, or the most dangerous thing, is the age of initiation. You see the last two lines, Children at the age of 15 or 20 are becoming the targets for using smokeless tobacco because it's very cheap, it's widely available. Any shop you go in India, in rural India, you can get these for 5 rupees or 2 rupees. And these are the pockets where if you want to really plan any anti-tobacco measure, so these are these dark colored pockets or the areas where there is a real production issues and abuse issues. The central part of India, Madhya Pradesh, Orissa, Bihar, UP, the central part, that is the maximum affected by this epidemic. Coming to smokeless tobacco, so we often listen that prevention is better than cure. So this is the best example. We are faced, I am a surgeon, I am a surgical oncologist. Around 30 to 40% of my patients I see in my clinic are oral cancers, young oral cancer patients who are coming from poor background, and every day I just feel sad for them because they don't have the knowledge, they just get hooked to these kind of habits and they end up with very huge mutilating operations, radiotherapy, and low quality of life and survivals for advanced oral cancer range between 40 to 50%. So if you look at the oral cancer incidence, these are the high incidence pockets. India ranks one among the top for oral cancer. And if actually it is not the lung cancer in India which is common, if you combine mouth and tongue is part of the mouth. If you combine both of these, that exceeds the incidence of lung cancer. So what I feel is I think the oral cancer is the most cancer in India. And there is a slight difference in the West and India compared to subsides. In the Western countries, it's mostly the tongue cancer or the floor of mouth cancer, which is common. Whereas in India, because of the typical chewing habits, it is the buccal cancer, alveolus cancer, because most of the people keep their tobacco in the sulcus here. So when you come to the treatment, so we are seeing the victims once they are affected. So what these patients undergo is a kind of very mutilating big surgeries and radiotherapy, just because they have got hooked to this tobacco habit without any knowledge and awareness. And these are the kind of surgeries they require, removal of large parts of the important structures in the face, including bone, soft tissues, and this is again a part of the bone being removed. And we may have to remove parts of the bone. These are all young patients, very young patients in the productive age group. Unfortunately, they got hooked to the tobacco, and this is how they are ending up. And they also require neck dissections. And we are doing our best to improve the quality of life. So we are changing the quality of surgeries, also going towards more functional surgeries. I will not go into the details. Coming to the last few slides about the anti-tobacco campaign. It's an international multi-sectoral effort. You need to involve all the stakeholders, including the target population, the victims of tobacco epidemic, the medical community, NGOs, tobacco industry, and the government. That's why it's a big challenge to fight tobacco anywhere in the world. And you can implement the programs at different levels, starting from manufacturing, procurement, marketing, distribution. At different stages, you can cut down the risk of tobacco. But you must always remember the tobacco industry is the most powerful, rich, politically well-connected industry. The tobacco industry profits on the harm caused to their customers. So it is not easy to fight this industry. We need to develop an action plan. Legislation plays an important role. Especially we have seen in India banning tobacco advertisements, banning smoking in public spaces, banning tobacco sale to children in school campuses. Taxation measures will have a very big impact, and of course media is playing a big role, because nowadays the reach of media is quite widespread, even in developing countries like India. I think media is also can play a big role. And just to show the complexity of the tobacco campaign, on the left you have the various ministries which will be involved. Suppose you want to start an anti-tobacco campaign, you need to involve these many ministries. So that is why the process is very slow, time-consuming, and very challenging. And this is just an example of a rising taxation. My next speaker was discussing with me how it is the single most effective tool in control of tobacco. We were having a chat. So this graph shows the simple increase in taxation will bring down the death from tobacco epidemics. And these are the few important events that have been taken place in the global fight against tobacco. The first initiative was taken by the WHO, that is FCTC. which is actually Framework Convention on Tobacco Control. This is first international public health treaty, one of the most successful treaties that could be ever started. Basic tenets of this treaty are M power. M means monitor tobacco use, P means protect the people from tobacco, O means offer help to quit tobacco users, W means warn against the dangers of tobacco, E means enforce ban on tobacco advertisement, R means raise taxes, M power. So unless you address all these aspects, you cannot control tobacco menace. Government of India, I will just run through the slides. Professor Rath has highlighted, and he is one of the important members in the Ministry of Health and Family Welfare. In this program, in 2010, they have launched the NPC DCS, that is National Program for Prevention of Cancer, Diabetes, Cardiovascular Diseases, and Stroke. And basic structure of this program is you need to control these 4 diseases, that is cardiovascular, diabetes, cancer, chronic respiratory diseases, and 2 conditions, that is mental disorders and injuries, and addressing the risk factor, that is physical activity, unhealthy diets, tobacco, and harmful use of alcohol. So this is the complete strategy in this action plan. So the tobacco fight in India is not very new. It started in 1975 with the Cigarettes Act of health warnings on cigarette packets. In 2000, then came the Cable Television Network Act prohibiting tobacco commercials in televisions. And the Landmark Act, that is COTPA, that is came in 2003. I will just show you the major highlights of the COTPA. The partners, because I'm just highlighting the various stakeholders and partners who have been active in tobacco fight, because if you want to plan a collaboration, the French government wants to plan a collaboration. So these are the groups who are active in India in the fight against tobacco, which includes the World Health Organization, Public Health Foundation of India, Voluntary Health Association of India, Campaign for Tobacco Free Kids, World Lung Foundation, and USC. The current structure of tobacco control program in the ministry, we have a central government, that is Ministry of Health and Family Welfare, then we have state tobacco control cells, district tobacco control cells, and at a local community level, we have different organs of the tobacco control strategy. So this is the coverage of National Tobacco Control Program in India currently. It's almost reaching 70% of the population. And these are the few popular campaigns. I think most of you must have seen these campaigns in the TVs. These are very popular campaigns. They are having a big impact on the patterns of tobacco usage. This is, I think the credit should go to the Ministry of Health for taking this initiative. And the challenges for developing countries include the rapidly rising population, increasing life expectancy, lack of awareness and education, lack of access to affordable health care, limited government resources, difficulties in implementation of policies, and of course, last but not the least, that is predatory strategies and politico-economic influence of tobacco lobbies. So there are various challenges, including taxation challenges. For example, tax structures are not uniform in India. You move from one state to other state, the tax structure is different. You go for a tax of cigarette is different, tax of BD is different, tax for tobacco, oral tobacco is different. So you need to have a uniform, very stringent sort of a taxation policy. And we also have challenges where including education and awareness, sales and smuggling. Suppose one state bans, the other states smuggles the tobacco, because it is like India is like a European Union. There are 25 different countries. So if Gujarat bans, the supply can come from Maharashtra. So there has to be an integrated approach. And of course, we also had our own share of political controversies. Recently, there was a big debate in the parliament, in our parliament, regarding the increasing the size of tobacco warnings on cigarette packets. So this resolution could not be passed because the politicians felt there is no evidence to support that tobacco causes cancer or kills human beings. France is also one of the most affected nations in Europe. My next speaker is going to speak on their fight against tobacco. It has a strong public health movement, legislative measures to decrease the tobacco usage. And if you see the trend of decrease of smoking in France between 1965 to 2002, it's almost 50% reduction. Excuse me. The last 2 slides. So use of law and policy to limit tobacco consumption illustrates one of the greatest triumphs of public health in early 21st century. We stand at a crossroads of tobacco epidemic with the future in our hands. We can choose to stand aside and take weak and ineffective steps, or instead implement robust and enduring measures to protect the health and wealth of the nations. If you don't do this, this is what is going to happen in future. Thank you.
Thank you.